Welcome to the Point of Medicine podcast, brought to you by LearnNeuralTherapy.com. Doctors Ann Hill and Alana Gurvich team up to take a deep dive into the art and science of healing. This podcast explores cutting-edge approaches to the autonomic nervous system and its role in organizing fascia for optimal health. Each episode features conversations with leading clinicians who are pushing the boundaries of medicine, uncovering new insights, and transforming patient care. Join us as we bridge tradition and innovation to expand what's possible in modern healing. Just a reminder, this podcast is for educational and entertainment purposes only and not intended as medical advice. Please consult your healthcare provider before making any changes to your healthcare plan. Join us and let's jump into the next episode.
Okay. Hey, everybody. Welcome back to the Point of Medicine podcast. And today we're really excited to have Dr. Rachaele Carver on to be speaking with us about how she utilizes neural therapy in dentistry. And she has been a biological dentist for 22 years and has her own podcast that I was on a little while ago, I think. And we met at a neural therapy class in New York. So I was really excited to have her on because we love having neural therapy in the dentist's hands because there's so many great things that you can do and treat. So we're excited to talk to you about that today. So let's dive right in. Can you tell us a little bit about yourself and how you got into, becoming a dentist and how you got into neural therapy?
Sure. Well, first of all, it's great to see you guys, and thank you for inviting me. We were just saying, I can't believe it's been, a few years since we all got together. What I found fascinating at that course where we met was so many of the points we inject are in the head and neck, right? So it's like, gosh, shouldn't every dentist know how to do these kind of things, right? It's exciting. So I got my dental degree back in 2003 from UConn, and the first few years I first worked in Boston and then moved to my hometown in the western part of Massachusetts, started my own practice, and was practicing conventional dentistry for a few years. And then after my second daughter was born in 2011, I developed eczema all over my hands. So you can imagine, as a dentist who's washing their hands and taking gloves on and off 1,000 times a day, like, it was just excruciating. I couldn't bathe my kids. It was just a lot, right? So I had 2 babies. I had a brand new practice, so might as well have had, an extra set of twins. So a lot of stress, right? And of course, at that time, I just went conventionally to the dermatologist, and they just wanted me to be on steroids forever, right? And after the third cream stopped working, she gave me an immune system altering drug they use in cancer patients. And I was 33 years old at the time, and I was just like, it was just my aha timeout moment. Like, this is just not right, And I said, and I think a lot of people who've gone into the holistic, integrative, field have either a personal experience or a friend or a family member. And I said to myself, my body is trying to tell me something. I just have to figure out what it is. So, long story short, after about, 10 years of investigating one thing after another, as I started to see all these different, I don't really like the word alternative, because most of these are actually traditional natural therapies, right? It's going back to what we learned the first year of med school, like how the body is supposed to work, right? We learn all about physiology that first year, and then we never think about it ever again, right? Because at year 2 and on, it's all about pathology, right? And so I started to think about dentistry a little differently, and I was like, wow, if there's this whole other field of medicine, could I be doing dentistry differently? And my first avenue into this different way of thinking of dentistry was ozone. I had been going to see a colon hydrotherapist because I'm like, I got to clean out my intestines. I got all this, leaky gut and blah, blah, blah. And she had an ozone sauna. I had never heard of ozone other than, the ozone in the atmosphere. And so I started researching it. I was really big into reading and researching at this point. And they had ozone for dentists. And I was like, what is this, right? And so this was 2015, 2016. I did one course and then an advanced course. And that's when I first learned about neural therapy. So it was in the second in the advanced course where we were learning about procaine and how we could use procaine and ozone together, and learned about major autohemotherapy. And the person who taught me that also has an entire curriculum where I got my naturopathic degree. I did an 18-month course learning, and at the end of that, I became board certified in biologic and naturopathic medicine. And so again, that's where I learned a little bit more of the neural therapy. How do we use that in dentistry? Dentistry is so much about pain, right? Pain. Where does pain come from? It comes from nerves. And a lot of times, it's really, you can be really stumped in dentistry when somebody comes in and they have all this pain, and sometimes it's obvious, right? They have a big cavity, or you see a big abscess on an x-ray, but sometimes it's like vague pain and you don't know where it's coming from. And it always what I'm trying to do is prevent. So what can I do? And so my thought process when I think about pain is that there's some energy, something that's interfering with proper energy flow, right? I also did a lot of study in energetic medicine because I really believe that it's the bioenergetics that underlie all the biochemistry. So, in school, we're really taught about, you take this vitamin and it fits on this receptor and then it gets into the cell and, all very mechanical. But in all my studies and in my own personal experience, I really feel like none of that can work without energy, right? Everything in the world is energy, even our bodies here. This is like a physical manifestation of energy. So if the energy isn't working right, if it's not flowing, that's where we're going to have symptoms, right? And so we talk a lot about dentistry about, or in energy medicine about interference fields, right? So if you have a scar, an injury, the fascia's all messed up, then energy can't flow properly. And so this is where that neural therapy has come into play. How do we use energy, right? Like in the form of an anesthetic, procaine or ozone, I use that to reconnect the highway, right? It's like if there was an earthquake, right? And the highway gets broken in piece. How do we put that highway back together so now the cars can flow again? And so in a lot of people with the tooth pain, they may have this, what we call a reversible pulpitis. They have the hot, cold sensitivity. It hasn't gotten to the point where it's so throbbing yet that it's abscess and we get into the irreversible stage. So what can we do in that reversible pulpitis stage to put energy back into the system, to rewire, right, the nervous system and get resolution? How do we get the oxygen and the nutrients back to that tooth so it can heal itself? Because I 100% believe if we can supply the body with the energy and the nutrients it needs, it will heal itself. So it's probably a long answer to your question, but
well, let's not leave this topic yet because it's very interesting. So what you found is that if you inject ozone into the space, you can do something that will actually turn around that pulpitis. Is that?
Well, that is the theory, right? It does not always work. And I think this is where neural therapy comes into place, because a lot of times where we feel pain may not be the source of the pain, right? So then when I learn about neural therapy, you have to think beyond the symptom, right? So this is where that whole holistic mindset comes into play. So tell me what's going on in your life. Where are the stresses? Let me feel around all the muscles. And this is where I always bring out my tooth meridian chart, right? And so every tooth, Dr. Jerry Tennant from Texas talks about teeth as circuit breakers. And he says, so if you have a root canal, right? A root canal means you take out the nerve and the blood supply of the tooth. So the tooth can stay in and still be mechanical, you can chew with it, but now it's dead. It's a dead organ, basically. And so Dr. Tennant believes when you have a root canal, you shut off that circuit by 60%, right? So let's take a lower molar, for example. Lower molar dies, you have a root canal. So that is connected to your lungs and your large intestine. So when that is shut off, now it's not going to say that the root canal is going to cause problems in your lungs or large intestine. But I explain it to my patients, imagine your immune system has 100 soldiers in its army. If 60 of those soldiers are up here trying to deal with this dead organ, because anytime you have a dead organ, that's going to harbor, right? The whole frequency, right? Or the energy system in that area is going to change. And it's going to attract all sorts of bugs, Lyme and bacteria and fungus and parasites, right? And so if 60 of your army soldiers are up there trying to deal with that mild infection, then you only have 40 left on that whole pathway, right? So, we make cancer cells all day, every day. And usually we have a robust army of 100 soldiers and they can combat that and we're all good. Well, if we only have 40, some of those cancer cells may escape, right? And so we develop problems. So that's what and I see it all the time. It's fascinating to me. I had one patient, it was a new patient. He came in and we're going over his medical history. And he had told me he had follicular lymphoma of his ureter. And I was like, I've never even heard of that, but okay. And then looked at his dental x-rays and he had one single root canal right in the middle of his lower front tooth, which is on the urinary meridian, right? So it consists of the kidneys and the ureter, the adrenal, like that whole area. And he had had that root canal 8 years prior. So I was like, it's just fascinating. And again, not that the root canal caused the follicular lymphoma, but if there's less energy in that circuit, right? There was less energy when that lymphoma started to grow. And this is my theorizing, right? I don't have proof of this, but that there was less energy to fight that. Now he was able to be cured, it was yay for modern medicine. But it's just interesting when you kind of think about why did that cancer like overgrow in the first place? So again, and I see a lot of connections. So upper molars, the second and first molars, are on the breast and stomach meridian. In my practice alone, I've seen 5 cases of women with abscessed teeth and breast cancer. So again, not necessarily a causal relationship, but there's a problem in that whole circuit. I had a patient the other day. We've been trying to move her teeth with Invisalign. And there's this one tooth. It's so stubborn. I cannot figure out why it doesn't want to move. And then she said to me the other day, I just got diagnosed with kidney stones. Gosh, how weird is that? That tooth is on the kidney meridian. Like, what's going on energetically along that pathway that it's not moving? So how do we get energy in these pathways, right? I mean, how do we get energy in general, right? We have sunshine. We're getting that light energy, which I think is totally overlooked, right? We don't understand how much our body actually interacts with these photons, but that's why they say, right? You need to get some sunlight every day. It's not just about vitamin D. There's actual, the photons actually energize our mitochondria, which are the organelles that produce energy in our body. Okay, so sun directly affects the electron transport chain, makes our ATP energy. Okay, so that's number one source. Now I live in the, Northeast. We don't get a lot of sun, for half the year practically, right? So that's where things like red light come in. I love red light and I use it in my house. We have it in the practice, right? So another source of energy. So I use a lot of that in the practice too, with these kind of what we call like hot teeth, right? So where else do we get energy? Nutrition, obviously, right? Are we eating the right diet? Do we have enough minerals and fat soluble vitamins and B vitamins? But not only are we eating them, are we absorbing them? Because that's another big problem today. Like we maybe think we're eating well, but our nervous system is so out of whack, right? That maybe our vagus nerve isn't stimulated enough. And so we're not getting enough digestive enzymes and stomach acid and on down the line. So we got to make sure we're getting that good nutrition to have energy. And then you got to think about what other kind of external sources. And that's where I think things like procaine and ozone. Ozone is incredibly energetic. It is, and like when you get an injection of it, if you go really fast, it hurts because it's very acidic. That's another thing that's interesting to think about. We always think of acidic things as bad, but actually acidity in certain things is full of energy, right? And so we're always thinking about, you got to alkalize the body. And that's, in some cases, yes, and some no, but there are certain areas like our stomach, our skin, like it's supposed to be acidic because that's a barrier, right? That's how when we're swallowing 200 liters of saliva every day full of bacteria, we don't want all of that, getting into the system. The stomach acid is supposed to be really strong and kill a lot of that, right? So we don't get SIBO and, fungal overgrowth and all sorts of weird things in the intestines that aren't supposed to be there. So ozone has so much power, all that acidity, to try to kind of, again, reconnect those pathways that are somehow interrupted from, like, is it decay? Is it trauma? But again, we always have to look. So let's say that molar is hurting. I might give a little injection of ozone right there, but then I'm also going to go back to where that nerve comes out of the jaw, right? I might even go up into the upper area, because we have, right, the facial nerve has like all 5 branches. So maybe the problem is coming from a lower wisdom tooth. I see this a lot too. So there's something in dentistry we call, especially in biologic dentistry, we call cavitations, right? So maybe you had wisdom tooth out a decade ago and it healed over fine and you have no symptoms, but maybe the bone didn't heal properly. So there's still a hole in the bone. And just like in a root canal tooth, because there's no blood supply, so now the immune system is not surveilling that area anymore. So microbes love to sit in there. Again, Lyme and parasites and all sorts of bacteria. So they're sitting in that hole. They are giving off their toxic byproducts, which are leaching into our lymph nodes, right? 20% of our lymph is in head and neck. So all of that is leaching into our lymph system. And think about it, as women, it's leaching right down where? Into our breasts, So, breast cancer, to me, everything's about toxicity infections, in my opinion. And you could say the infections create toxicity, so it's all about toxins, right? We can be nuanced about things, but so you got to think about that. And the problem is that most of the things don't hurt. So people, like dentists, we're not trained in this unless you've done some of this biologic work. So, and a physician certainly doesn't know anything about this. So you're not looking. We look to where the symptom is. So when you're thinking about neural therapy, you have to really understand the way nerves work, the way they're all connected. You have to understand referred pain. So I've had a couple of cases where that wisdom tooth, let's say it's a lower wisdom tooth, that's the most common one to be cavitated. That's where the infection is happening. But again, because those nerves are all connected back at the root, back by kind of around by the ear, a lot of patients feel pain in the top teeth. You'll see lots of patients who get one root canal because the tooth is hurting, because this is what we're trained. When the tooth hurts, get a root canal, you take out the nerve, you're good. Everything's great, right? Okay. You can still chew on it. The tooth is still there. We're not trained about the fact that it's now a dead organ. Like that is not part of dental training, traditional dental training. So then the pain is still there. So then they get the tooth behind it root canal, and the pain is still there. So you can see people who end up having like a mouthful of root canals and they never have gotten to the source, of the tooth. So that's the tricky thing. When you're thinking about pain, think more holistically. So I'm always, if I can't find a cavity or, so either a tooth can die from decay or trauma, right? So whether it's biting trauma or, being hit in the mouth or something like that, and if you don't see either of those cases, I'm always like, I put my detective hat on. Well, where else can it be coming from? And so I like to try these things with procaine, with ozone, because basically when you're in pain, right, the nerves are so jacked up, really high. So that it doesn't take a lot of stimulus to keep you at that high, overactive nerve, right? So what the procaine and ozone kind of both do is they bring down that membrane potential, right? I'm not sure how to say it in really layman's terms, but what it means is that it takes a much higher stimulus, right, to create that pain again, right? So again, you're injecting energy into the system to help the body kind of heal itself, if it's just inflammation again, but you got to find where is it coming from.
Can I ask, okay, so there's a lot that you just said that I would love to chunk out. The first thing that I've never heard before, which I would love you to explain, is how are you using red light in dentistry? Anne, have you heard about this before?
Mm-hmm. Yep.
Okay, I've never heard about it. Can somebody explain it to me?
Dr. Carver, that is a question for you.
So as we know, like the red light, as I mentioned, like photons affect the mitochondria, how we make energy. And when we think about mitochondria, if you think about aging, right? If you go to the biohacker sites and you listen to all they're saying, aging is basically mitochondrial dysfunction, right? And so as we get older, we have fewer mitochondria and they're more dysfunctional. That's why as we get older, we're more tired. We get more infections, all these things, what we typically think of as aging is because those mitochondria aren't working as well, right? So all these biohackers are trying to, boost mitochondrial function and increase the numbers with all sorts of different kind of therapies and supplements. So, and mitochondria can be in energy production state or they can be in defense mode, but they can't be in both. So if you have a lot of these low-grade infections, which could be in the mouth, right? You could have all these infections and not know it, right? Or all these other toxins. I mean, think about our world today. There are 80,000 chemicals in the environment today, right? And we can't avoid them. I don't think organic exists anymore. The stuff's in the air, it's in the water, it's just everywhere. Some of us have better detox systems than others, right? But when those toxins, again, whether it's a microbial toxin or an environmental toxin, they gum up that mitochondria, right? We learn about the citric acid cycle, the Krebs cycle, how we make energy. Well, if it's gummed up at that first step, right, because of these toxin infections, we don't ever get to the point where we make ATP, right? So the mitochondria are trying to, they're in that defense mode. And so, of course, one of the number one symptoms we always have is fatigue. We're not able to make. So how can we support our mitochondria? And red light is one of the best ways. So you can kind of skip over that Krebs cycle, go right to the electron transport and affect complex 4. That's what it's called if you want to get real technical. And that helps, boost the ADP into ADP and makes all sorts of good stuff, creates water and all sorts of that good stuff, right? Red light is also important for making that structured water.
So you are not necessarily, you're using red light over the entire body to support the mitochondria, or you're using it locally onto the tooth or in the mouth?
Yeah. So I have a lot of devices, they make panels, right? So I actually stand in front of my panel almost every day, just, because again, in the Northeast, I'm not getting good sunshine and I don't have time at 9:00 in the morning to go out and enjoy it because I'm working, right? So in the office, we have handheld ones. So I have one that's a little bit bigger that I use extra orally. So again, after an extraction, right? I've had that mouth open for 30 to 60 minutes, right? The muscles get tired, the fascia gets tired. They've just had surgery, right? So the red light, and when I use the combination of my red light, my ozone, platelet-rich fibrin, the healing on this, I have never seen anything like it before in my life. It's amazing. I can't remember. I don't give it. Patients don't even, let alone, don't get any kind of medical, drugs, not even ibuprofen. We give them a little arnica, send them home with ozone and olive oil. They're amazing. Even the most difficult surgical, tough extractions, when you put in that energy with the light and the ozone, they heal amazingly because we are supporting the body's ability to heal versus, giving, an opioid or, nothing else, right? Or, tell them to use ice so they don't swell. Don't ever, 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 ever put ice on a wound, right? Yes, it stops the swelling, but it also cuts off the blood supply. We don't want that. When I do extractions, I never use epinephrine. I don't want to cut off the blood supply, right? The reason why we have epinephrine in dental anesthetics is to allow the anesthetic to stay around longer, right? Because epinephrine constricts blood flow. What happens when you constrict blood flow? You reduce the energy, right? You're reducing the blood. The blood is what, and all the good stuff in our blood is what helps us heal. So yeah, sometimes it's a little bloody and it can be a little challenging to seal, but I don't care because I want to have good, healthy blood flow. That's what causes a dry socket when there's no proper blood flow. And I would say probably 95% of dry sockets become a cavitation. Whether people know it or not, it becomes a cavitation because what the dry socket is when that blood clot comes out, exposes underlying bone, right? You need blood in order to heal, right? Because blood that's why we use platelet-rich fibrin. It has all the platelets and the growth factors and all the immune cells to help you heal. That's what your body needs to heal. Yes, eventually you're going to heal fine, but would you rather heal, faster and easier, right, than have to have those kind of complications? So we'll do that externally. Then we have one that has a little point, so you can get right in the mouth. And so red light's really interesting because there's like a bell curve, right? So when you get to a certain point, it becomes inhibitory. So the first few minutes will be stimulatory, right? So we want to stimulate healing. But the longer we do it, it actually becomes inhibitory. So you have to think, what am I treating with red light? And so after an extraction, they're not in pain yet, right? Because they're numb and all that. So I want to stimulate healing. So I'm going to do 60 seconds. That's it. My assistants, after I'm done and sutured them up, they get 60 seconds of red light or what we call photobiomodulation. Now, let's say a week later, they're having pain. Doesn't often happen, but let's say or you have pain anywhere, right? Then you're going to want to use it for maybe 10 minutes, right? There's all this science and math to it that, we don't need to bother with. But again, thinking about, so if you're trying to heal something, you don't want to do it too long because then you're going to inhibit things. So, so there's a lot kind of to light therapy, but again, I'm trying to stimulate healing. I want blood flow. So like when you get an injury, my kids play sports, they fall down, they, get a swollen, they twist their ankle. I want red light on that immediately, not ice. I tell this story a lot, but my husband in COVID, he was, bored. He was out there. He had a hoodie on with the strings hanging down. He was grinding metal paint off a metal chair. And he had this grinder and it caught the string on his hoodie. So at 7,000 RPMs, his hand came right up. I mean, 1 inch in either direction would have been absolutely tragic, but he hit his cheekbone, right? So the sweatshirt kind of closed. So there was a small little, little gap there, and he kind of came back into the house all disoriented, and his eye started swelling immediately. And I said, get in front of that red light right now. Within 3 minutes, there was no swelling, and he only had like a tiny little cut right there. But I said, well, we better go to the ER because who knows what else you did to yourself. And so this was right when COVID started. So I was sitting out in the parking lot for like 2 hours, and I finally called in. I said, what's happening? What's going on? Well, the doctor, he first went in, they said, oh, you'll be out in 2 minutes. It's just a tiny little cut, no problem. And he said, but we better do a CT just because. And when the doctor came out, his jaw was on the floor because he's like, I don't understand. He said, you broke every single bone in your sinus. How are you not swollen? I don't understand what's going on here. And so we had to wait for the oral surgeon. So I called and they're like, we're waiting for the oral surgeon. So I had him on speed dial, and, he's my buddy. And I was like, Eric, it's Pete, go take a look at him. And he called me back and he said, whoa. He said, Rachel, wow, he is going to be black and blue is not going to be pretty. And one of the nerves that supplies our teeth right there comes from right underneath the orbit there. And so he didn't have feeling in 3 of his teeth there. So we had to go to the oral surgeon the next day. We walked in, same thing, jaw on the floor. I don't understand. Why is he not black and blue? Why is he not swollen? I don't understand this. And he said, because we use red light for 3 minutes. That's it. 3 minutes. And then between the red light, and then I have a small handheld pulsed electromagnetic frequency device. Same idea, right? Like with neural therapy, we're putting frequency into the body. So I had a setting that was called teeth. And the surgeon said, he may never get the feeling back in those teeth. He may end up losing them and getting root canals and all this stuff. In 6 weeks, he had all the feeling back in his teeth. And this is 5 years ago now. Never, ever had swelling, never had a black. I mean, if that's not the power of light, I don't know what is. I mean, it's incredible what light can do for something that's so not, and now it's so widespread. It's so affordable to get these little handheld. I mean, you can order them even off of Amazon. So just amazing. I try to get like almost all my patients to have a red light.
I was just going to ask, what do you recommend that your patients get?
So
is there a brand that you like?
Yeah, LightPath LED. I actually had one of my podcasts was with the owner of LightPath LED. But I first learned about the company Usui. The thing about red light is it's all frequency. Like they can make them look a little different, but it's all the same frequency, the same wavelength of light. So does it really matter what company you use? I have different ones. I have the panel so I can do my whole body. I have a handheld one so I can do small areas. Because one of the things we do, we talk a lot about, in my opinion, like when your nervous system is out of balance, nothing's going to heal. No matter what you're eating, what you got to get that nervous system balanced. And one of the best ways to stimulate that vagus is with light. And so you can shine the light into your ear for 1 minute on either side. 1 minute, morning and night. And that will help reset your vagus, right? Because the vagus is kind of right in there. I'm like, again, such a simple tool you get a huge bang for your buck using light therapy. We give our patients a whole packet of, there's like 10,000 articles about red light. And the LightPath LED is an awesome website because he has a million different videos for different uses. So you can go on there and say, okay, I have a sprained ankle. What's the best, how should I use my red light? Because that's what patient always asks, well, how do I use it? And there's a whole, system. You can start with the day to, you do it over different acupressure points. And that will, again, stimulate good energy flow, right? So instead of a needle, if you don't like the idea of, having the needle, you can just use light. Like we can use pressure, right? Or you can use light, and it has the kind of same effect on all those acupressure points, which is really exciting.
Okay, next, I want to go back to something that you said a little bit earlier when you were talking about using procaine and ozone, like when you were talking about the patient who had the root canals all the way up the tooth. Can you talk us through what would be your diagnostic procedure to work up if it's the nerve, if it's the tooth, like how you as a biological dentist kind of would differentiate through a patient to explain like what your thinking is?
Sure. So let's say a patient comes in, they're like, I have pain over here, right? Usually when a tooth is abscessed, the patient will be like, it's this tooth, right? It's very specific. But before it abscesses and we are in this reversible pulpitis stage, they're like, I don't know, it's coming from here. Again, think about those nerves, right? They're all kind of connected. So it can be very hard for somebody to pinpoint exactly where it's coming from. So you can use procaine or lidocaine, any other kind of anesthetic, and you can say, all right, maybe, again, if you don't see anything obvious, and we're doing our detective work, so let's give a little anesthesia over this tooth on the top. Oh, I still feel it. All right, and you can work with anesthesia. Now with the bottom, because the jawbone is very dense, the only way to numb up the molars there, you have to go all the way back to where that nerve, the mandibular nerve comes out of the bone, right? So with an upper tooth, you can be numb just one specific tooth. But when you have a lower molar, anybody who's had dental work, it's like that whole side of your face, feels numb. So that's another way you can kind of determine, okay, let's say nothing on the top. I still feel the pain. All right, now I'm going to numb the whole mandible. Oh yeah, the pain's gone. Okay. So there's something along that nerve branch, right, that is affecting it. So now I'm going to give a little bit of procaine and ozone way back there where that nerve comes out of the brain, and see if we can give enough of the procaine and enough of the ozone to get rid of the inflammation altogether. Then great, maybe the nerve can heal and the pain goes away. I like to use a lot of B vitamins too. In dentistry, we talk a lot about, people have this thing called geographic tongue, where your tongue kind of has, it looks like islands on it. And in dental school, you're like, it's just geographic tongue. It doesn't matter. It's nothing. That kind of stuff drives me nuts. Like, well, that's not normal. Like something's going on. So what I think about that is thinking about, it's an autoimmune, like a gut issue, right? Usually that person has leaky gut. They usually are not absorbing their nutrients, right? So when you have canker sores and ulcers, that's usually, or you get the cracks on the side of your mouth, it's usually a B vitamin deficiency. So simply like really, and nerve B12, right? B12, B1, I think those are really specific for nerves. You can then kind of high dose that too to see if the nerves, or sometimes I'll use hypericum. So I always think, I'm like, okay, if I could use the ozone every day for 2 weeks, I could probably cure this tooth. But that's not realistic, right? A person can't come in every day for 2 weeks. So I'm always thinking, okay, what can I give the patient to go home with? Awesome. That's why I try to make a lot of my patients get a red light. Because if you're doing red light, same thing, you're going to stimulate and you're going to produce energy to help the body heal. I also use homeopathics. I might use an arnica or hypericum, right? Hypericum is very specific for nerves. And I like to use muscle testing because in my logical brain, I can think it maybe it's B vitamins, or maybe it's, maybe you need ozone, but I don't know for sure. So I learned muscle testing as a way to test patient for a specific substance or supplement and how to dose them. So that's that also will help me. And that I can say, okay, you need hypericum. What is the dose? Do you need 1M? Do you need 200C? Okay, you need 200C. That's what you're testing for. And how many times a day should you take it, and for how long? So I really like, again, that's a branch of energy medicine where you're tapping into your patient's nervous system, basically, to really help decide what might be the best course. And sometimes I'll use Chinese herbs that they kind of tuck in along that tooth that's painful. Does it always work? It doesn't always work. But again, if they could come in and have that ozone, I'm always searching for that next thing that's like, oh, how do I get, and as I'm talking to the patients, how do you get a good source of energy, right? We have like the pulsed electromagnetic frequency. Those are great devices too. Those are expensive though. Those are thousands of dollars. Not every, people aren't going to buy those. So always trying to think, whereas red light now, you can get a little handheld light for a couple $100s. And that is pretty cheap for everything that can do. Crazy cheap and like so worth it. You could use that every single day of your life and get benefits with that. So
how about ozone oil? How does ozone oil fit into this whole?
So we have a couple different ozone oils that we use in our practice. We have one that's thinner that kind of looks like olive oil, and it's loaded with all sorts of minerals and vitamins. And that I'll use like maybe topically. I tell patients, put it on top of your toothpaste, right? That we use a lot for gum. Now, if you have like after an extraction, we'll give the thick ozonated olive oil that's like Vaseline, basically. And that anywhere you might think I got to use Neosporin, you use that instead. But you can use ozonated olive oil in the mouth. It tastes a little chlorine-y, so if you can get used to the taste, but man, does that heal. Like that is absolutely, that's another thing. So in everybody's, first aid kit at home, they should have a red light and they should have ozonated olive oil. And I travel with those everywhere I go because that, unlike Neosporin, which is just for bacteria, ozone kills bacteria, virus, parasites, fungus indiscriminately, right? Because of that oxygen, it really doesn't matter what the cell wall or whatever looks like. It just can, because it's an oxidant, it just pierces through whatever membrane that stuff has. And they try to teach us that it doesn't really affect the healthy cells because healthy cells have antioxidants in their membrane, so they're protected. How true that is, I don't know 100%. I wouldn't want somebody using the thick ozonated olive oil every single day because I don't want to kill everything. But when you're healing from certain things or you're having, that discomfort, I really love ozonated olive oil. We use a lot of that in the practice too.
Okay, I've got a question for you. My burning dentist question. I send lots of people to our local dentist to get worked up for cavitations and they get diagnosed oftentimes and they'll do surgery. But is there a moment where you could actually just work with procaine and ozone
I do
before doing that?
Always.
Okay.
Because thinking about interference fields, like anytime we cut anywhere, we're creating a scar. And we know anytime we create a scar, then as it heals, right, the fascia is going to twist and turn and, things are never going to be exactly like they were. And so I'm so big on prevention. Like I dream about the day I never have to pick up my drill ever again because we'll have prevented all oral disease, right? So there's a really great technique I like to use. So we look at the 3D cone beam and say, yeah, maybe there's a cavitation there. You cannot, in my opinion, just diagnose off an x-ray. I don't think you can. I think you really need to have more corroborating evidence. And I'm actually working with a biofeedback system right now. We're creating this whole network of kind of different frequencies that we're seeing. We have all these cavitation patients. And when we're seeing this overlap over and over and over again, we're like, okay, I think these are signs of, cavitation. And then when we go into a cavitation site, we're taking samples of that and putting it into the biofeedback software. So, it's in the baby preliminary stages, but I think that's really exciting because if we can avoid having to cut into somebody, great, right? So what I like to do is I use a little tool. It's called an X-tip. It's a tiny, tiny little needle. It attaches to my drill. And so I look on the 3D x-ray, I can see, okay, this is where that cavitated area appears to be. And I drill right into that area and the drill goes through the bone. And then I take my tip of ozone and, it can be procaine and ozone or one or the other. And I put it right into there. So we do that twice a week for about 5 weeks. And then I can also muscle test that. What dosage should I use for my ozone? Typically I'm using a lower dose, 10 to 20 micrograms. And then progressively as the weeks go by, you might use a little bit of a higher dose there. But again, you're using I use muscle testing to see how often do I have to do this? What is the proper dosage? how many times a week or whatever. And I've seen really good success with that. I had somebody, a chiropractor, refer from the Boston area, and he came all the way to Western Mass because he said he had a cavitation in one and he needs some ozone. All right, let's do it. Muscle tested him. Seemed like it would be good. One time, he went back to the chiropractor. He's like, yep, now there's no, everything's running great there now. I usually think it takes more than one time, but he was like, yep, I'm all better now. Just one. And I was like, oh my gosh, like it takes 5 minutes, right? It's not expensive, right? Ozone is basically, gas. Like the machine itself is a little bit costly, but nowadays they're really cheap. So of course I got one so many years ago, 10 years ago now, that was a fancier one, but I have a small one in my house that was, because I'm like, I'm using this so much, I need one at my house now too, so that I treat my kids and my family, right? Because you can do nasal insufflation, ear insufflation. So many people who have like clogged ears and sinus stuff, I don't know if it's where you guys are, but this winter, like everybody's had all this weird congestion stuff. And I'm like, pop in the ozone for 25 minutes. I charge $25 for that. It's not, the only cost really to me is, the nasal cannula. There's not a lot to it. So that's what I love about ozone. You're getting all these great kind of natural therapies that don't have contraindications. They don't have side effects, right? You can't breathe ozone directly. So when we do a nasal insufflation, we infuse it through olive oil. So you're breathing in like ozonides, because there are no antioxidants in your lung tissue. And that's why if you breathe it in, you start coughing really. I did that to my daughter once. I was doing ear for her and I didn't have the fan blowing strong enough. And I walked away for 2 minutes and then she started. So she has PTSD when it comes to ozone, that poor kid. But so what did I have to do? I just gave a high dose vitamin C, right? So she sucked it down and that stops the reaction. But it's a little scary. So, I don't really do that a lot on kids because that's kind of scary for a parent seeing their kid like not being able to breathe. But very quickly it's remedied with simple vitamin C. So yeah, there's a lot of really cool things you can do with that.
So the other question I have is, do you use, when you're doing the X-tip, do you also use procaine with that for the pain relief? Or do patients not feel that if you're putting it directly inside there?
I will numb the patient first, and then I put that in. Yeah. And so I do, the other big thing that I use the procaine for is TMJ discomfort. It is like a miracle. I mean, the patients, they have all this pain and discomfort. What's it coming from? First you really got to diagnose it, right? Is it inflammation or is there actual, arthritis or joint deterioration? So you can take a 3D X-ray, really kind of determine what's happening. And then using the procaine and the ozone, you just kind of I usually just give one shot. Sometimes you can go around the whole joint area. And sometimes I'll add another homeopathic, like a lymph draining one. And I'll use Zeal and Traumeal, which are acute and chronic anti-inflammatories. So I'll mix it all together for the patient, inject the procaine, wait about 2 to 3, maybe 5 minutes. And then the cool thing I love about this is the body tells you the proper dose. So when you already have the procaine, you're kind of numb. So you don't feel the injection then when you're putting the ozone. And you very slowly inject the ozone. And you inject it until the patient feels a little bit of tension or pressure, and it's fascinating. The more inflamed their area is, the more ozone it'll take. So let's say it's, mildly inflamed, maybe it takes 2 cc's. A joint that's severely inflamed might take 10. And it's really fascinating to see that difference. And I love seeing when you see it kind of puff, right? Ozone goes where it's supposed to go. So for me, you see like the little air travel along. And that's really helpful too, because when you see it, I also do a lot down the cervical spine there. And sometimes like on the shoulder blades there, right? Too, because that's where we hold so much tension, right? When you're having joint issues, it's very seldom that it's just the joint, right? It's usually all the muscles or everything is pulling and everything is tight. I think we forget in all aspects of medicine how the body is all connected, right? So I noticed when I first started doing that therapy that like maybe 90% would get better, but there was that 10% that like it didn't help that much. And then I started to look at their necks and their shoulders and how tight. And I was like, okay, we've got trigger points. So now I have that whole flip book, right, of trigger points. So that's what we were talking about. Again, where is the pain coming from? So that book is really helpful to see there are specific trigger points, like all down that area and like throughout our whole body. But when you give the procaine in the trigger points, you get a bigger response, and you get more relief because again, you're getting back to where that source might be. So I think that's really, really fascinating. And then once I started doing that, I'm like, oh gosh, these people who are like, I've never felt such relief before, which is really exciting because so many people just suffer with it because, they don't want to keep taking, ibuprofen or whatever, or these splints that we make people, these special mouth guards. It's just a Band-Aid, right? That's not really correct. And now sometimes we have to understand, like we can give that, it doesn't necessarily cure, but procaine and ozone are known to kind of rebuild the cartilage, right? If you can get rid of inflammation, the body will heal itself. We know that that's true, right? We have to supply the nutrients, the minerals, and the amino acids to regrow the collagen. But if you take away that inflammatory, that chronic inflammation, we can get regrowth, right? But again, you have to remember, well, what does it come? Is it because the bite was off? Because obviously if the bite's off, you can fix it momentarily, but in 6 months, it's going to come back. So you have to always think, what caused it. If it was an injury or something like that, you just get rid of the inflammation. A lot of times it's good. So it's interesting.
Okay, can I ask you, as a biological dentist, the question that I have for virtually every biological dentist? Okay, so you find irreversible pulposis, is that right? Did I say that right?
Pulpitis.
Mm-hmm. What's your strategy at that point?
So that's the conversation of the patient. Okay, it's irreversible, it's dead, we have an abscess. So in dentistry, there's 2 options. If we want to get rid of the infection, a tooth infection is not like a regular infection. You cannot just take antibiotics and it be gone, right? Once a tooth is abscessed, that blood supply is no longer going to the tooth. So if you take systemic antibiotics, it is not going to get to the tooth. It will not cure that. Now, if you have soft tissue swelling, which sometimes you do with a tooth abscess, it will help that. But in the absence of any soft tissue swelling, we do not prescribe antibiotics. The prescription is either extract the tooth or do a root canal. Now, I'm looking at that patient, I'm saying, okay, here's what I know about root canals. And I think about, so when you have a blown appendix, we don't open you up, clean it out, shove some rubber in there, and then put your appendix back in your body. Like we just don't do that, right? We cut it out. But in dentistry, it's the only area of medicine where we mummify something. We keep a dead organ in your body. And in theory, it's awesome, right? Who wants to lose a tooth? That really sucks, and like having an implant or something, it's expensive to replace a tooth, right? And so I think about that person. So let's say I have a person who's 20 years old, right? Their front tooth is, they're getting in an accident. They have an abscess. What can we do? Am I going to talk about a root canal? Yeah, I think that might be reasonable, right? They're healthy at this point. It's a front tooth, yeah, let's do it. Is this going to be in your mouth forever? Probably not, right? I show them the tooth meridian chart, so in the future, think about these things. If you start having these weird ailments, we may have to revisit that area. Versus, let's say you have somebody who has 6 autoimmune diagnoses, right? They don't feel well. They have no energy. In that case, I really don't want you having a root canal, right? I don't think your immune system can handle another dead organ, another thing that is potentially going to tax your immune system. So a lot of biologic dentists are like so against root canals. Like if you prescribe root canals, you cannot call yourself biologic. Well, I think that's hooey. I think if you're biologic, you're looking at the person's individual biology. And we are all different people. We have different lives, different genetics, different, environments. So you should not be so black and white. I think that completely goes against the word biology, right? We're all different. Our biology, maybe we're built similarly, but you have to consider everything on that person. And so I will give the patient the choice. I want them to have informed consent, and then it's up to them.
So then you talk to them, they're an autoimmune heavy patient, you decide to do the extraction, right? With that patient who obviously already is immunologically quite challenged, what's your stance on just leaving it open, like doing PRF in there and all that and doing a good extraction, or putting in an implant? What type of implant? Like, can you talk us through? This is a question. It does not matter how many dentists I talk to. Everybody has a starkly different opinion, and I don't even know where I land on it. So I'm looking for you guys to tell me where you land on it so I can have an educated landing point.
So what we've learned, Johann Leckerner, who is he's a researcher out in Germany, and he's done a lot of study on these like root canal teeth and cavitations, and also on titanium implants. And so what we know now is that titanium implants are not pure titanium, right? This is the standard that's used for all implantation all over the body. But most titanium is like 94 to 96% titanium. So there's that 4% that we're finding after 20 years can corrode, right? So that can, then you got heavy metals, again, leaching into your lymph system right here. So now we're saying, again, so that person who's autoimmune, I don't want any metal in your body. No way. One, if you can go without it, just go without it. Okay. There's something to be said too about, well, if you don't have teeth and you don't have the proprioception, what's going on with the brain signals? I don't know a whole lot about that. I mean, yes, obviously we're meant to have 32 teeth, but most of us don't because our jaws aren't big enough, or we've had, some dental issue or whatever, and we all survive okay. So that person, I think, maybe not, or if it's a front tooth, right, and they don't want to have a removable thing, let's go for a ceramic. Right. So ceramic it's non-reactive. So it's not good. The other thing you have to remember, when you get a titanium implant, if you put that next to a tooth that has a crown with a porcelain fused to metal crown or a gold crown, that's dissimilar metals. Dissimilar metals in saliva creates a battery. So now you got like mini battery. People with a lot of amalgam and a lot of metal in their mouth can be problematic. And a lot of times there can be heart rhythm issues because there's a lot of heavy metals, there's batteries happening, that can be problematic. Now I've seen 80-year-olds with mouthful of amalgams and they're healthy as a horse. But I also think 80 years ago, they weren't bombarded with the 80,000 chemicals in them, right? So their immune systems developed much more strongly than the kids today, right? I mean, it's crazy when you look at the new vaccine schedules and how much stuff is getting put in kids at such an early age. I mean, yikes. First of all, they're born with their buckets half full because moms, right? We're all so heavy and we're just, we're dumping it into the babies, without realizing, right? So anyway, that's a whole other discussion. But so you got to think about what is next to that implant that you're going to put in. So I would go for ceramic all the time. It's really interesting too, because titanium, they work really well. And in a person who's inflamed, they can still work because the bone around a titanium implant is more like sclerotic bone, whereas you have to have healthy bone for a ceramic. And the ceramic bone, a ceramic implant, if you ever have to take that out, it's excruciating because it fuses to really good, healthy bone. But I've had a patient who's had, failed because she was so inflamed, but the titanium one took okay. So that was the compromise that we had to make. She was okay with that. So,
what do you think about zirconium?
So that's what we use for the ceramic implants. We talk about that as, that's what they're used. So, and again, that's non-reactive. So that's what I like to use for my crowns too. Again, totally non-reactive, but ideally I'd like not to put any of this stuff in patient's mouth, right? Because, even the bonding, even the fillings, it's all plastics. And, I've found one that's the most biocompatible. It's a silica-based composite, but it's still, there's always these compromises. And so that's why I'm like prevention, people, how can we remineralize the teeth? What can we do to not have to, put a bunch, my younger daughter, she never smiles anymore because she has really small teeth. So she has a lot of gaps. And she came to me the other day and there was something on TikTok. She's like, can you do this? It was a video of somebody, bonding the teeth, right? Putting the composite to fill the spaces. And I said, I can, but I'm not gonna. Said, when you're a little bit older, I'm going to put ceramic veneers, because I don't want that plastic in your mouth. I want something like non-reactive. So, my other daughter, she has one filling, and again, it is what it is. You can't always get away from it. You have to do, the best that you can. But ideally, if we can get our energy always flowing well and getting our bodies with the proper nutrition, hopefully we can, avoid some of the, all the dental work, right?
So one of the things we ask every single one of our people we interview, which is a very unfair question, we say it every episode, what is your favorite injection? Like, is there one that you sense with your practice that you are pulling on again and again that you feel like moves the needle most regularly?
I think giving it to the TMJ area. I mean, it just feels like a slam dunk to me. Like every time. I mean, I would say, 90% of the patients I've done with have had complete resolution with that, and I say, I'm going to do this one time. And if you need a second one, I'm not going to charge you for that. And very, very few do I have to give that second injection. And again, when you're diagnosing it right as like inflammation, but it's such a game changer because these patients with that chronic jaw pain, it can really, I mean, it adds so much stress, when you have all that inflammation, the head feels yucky all the time. It's just such a game changer. And every time I do it, I've been doing it 10 years and I'm still floored by how amazing it is and takes away the patient's discomfort for something that's not expensive. It's not very invasive. And it's so quick and easy. So it depends, right? So I will fill my syringe with like 10 cc's of ozone. And then again, depending on when the patient feels it, right? It depends on how much inflammation. So the patient tells me the proper dose. But yeah, I'll take 1 cc of I used 3% preservative free procaine, and then I'll mix in my homeopathics with it. So the lymphomyosat, zeal, and tromil, and to mix that all together. That's the first injection. I make the little quaddle with that, and then I take my ozone and as much as they need.
So it's not in the same syringe.
No,
it's two separate syringes, 2 separate pokes.
So they usually don't feel the second poke because the procaine's made them numb. So yes, I use 2 different syringes.
And are you going right into the actual joint itself?
So when you open, and like the mandible has kind of a little U shape, right? So I'm going right into that U area. Right?
Wow.
And I don't have to go very far, just the quaddle, right, is obviously, very shallow. And then I maybe go in, I don't know, 3-4 millimeters, not a ton, because again, ozone goes where it needs to go. So you don't have to be super invasive, and create any damage anywhere. I've learned another technique. Sometimes you can go you kind of put 3 spots. You can go there and then at the front of the bone and the back of the bone. But I've gone in the back of the bone sometimes and hit the nerve, and then you get like the eye twitching, and that does not feel good. So I'm like, I'm not gonna go there.
Yeah.
So I have a patient right now that I was just injecting. She was scheduled to see the oral surgeon for her TMJ. And I was like, listen, I'm not going to say anything. Let's just throw some spaghetti against the wall. She got, after my first injection with her, she got, I think, 40% reduction of her pain. And it was like life debilitating TMJ pain. And I only injected one side to be somewhat scientific about it. But she was like, no. Now the other side is my painful side.
Yeah. I'm telling you, it's my favorite thing I've ever done. I say it. It's funny that you said it because I say it all the time when patient. I was like, this is my favorite thing I've ever learned because of how amazing the results are with something that's so simple.
It's so nice to have a little magical tool.
I know. Like I used to say that all the time. I'm working on my magic, right? And when I learned muscle testing, and patients look at me and they're like, what are you doing? It's like, it's magic. It's just magic, when you really can tap into the body's, unique structure there. I just love that.
Magic or energy, one or the other.
It's all one in the same. It's magical energy.
Wow. Well, you definitely get our award for witch dentist. How about that? We're witch doctors. You're witch dentist.
There
Amazing.
You go. I'll take it and I'll wear that label proudly.
Very cool. Well, can you tell us? We've taken up a lot of your time, and wow, I really wish that you were here in Portland I would be referring all my patients to you. Can you tell us a little bit about what is, just kind of for a last thing, what in medicine and dentistry right now is most inspirational to you?
Wow. You can tell I'm super passionate about what I do. And I love learning. And I think, right now, I think something that's often overlooked is that whole emotional piece, right? I talked about a lot of toxins, but, and we often categorize people with TMJ problems, right, in the mental health category, right? Because the doctors don't know what to do with them, and they're like, just give you some Xanax, or take an SSRI or something like that. But I think it's important to impact. So when we're thinking as doctors of how we're going to heal this patient, we have to remember that piece of it, right? I mean, why are we tense in the first place? So usually it's a lot of this mental emotional stuff. So I talk to a lot of my patients because for me too, like all of my issues I have, it always starts with the mental over chatter in my head all the time. And so thinking about how that impacts the nervous system, right? So how do we balance that nervous system? Because then everything else kind of works from there. So I get really excited when I think about what are the simple, I'm always looking for simple techniques that somebody can add to their day where it's not, where they don't really have to think about it, right? Like, how else do we get that vagus nerve activated? I say, well, you shower almost every day, right? So last 30 seconds of your shower, take some water and just gargle it. When you're driving to work in the morning, hum a little bit, right? So when you kind of stack habits that are super easy to do and free, that's key. The other big thing I've been really focusing on this year is breathing, because when we breathe properly, we also are going to stimulate that parasympathetic. And that's another very, very quick way, when we learn how to breathe properly, to get the nervous system balanced. And again, totally free. Everybody knows how to breathe. We think we do, right? So just giving patients, a few little tips on how to, because most people think, well, I'm a shallow. I had a patient, a consult today. He's like, well, I know I'm a shallow breather. And I said, yeah, we want to do deeper breaths, but more than the depth of breathing, it's how often we breathe, right? And when we're in sympathetic, we're breathing too much, too frequently. So teaching patients how to just slow it down. And I'm a patient too. I'm always trying to work, because I know I bought a little device to track my breathing. And in the middle of the day, I was like 18, 20 breaths a minute. I'm like, oh, geez, that's too much, right? So now when I'm curing, I'm using my curing light, and it usually has a 5-second beep. So that's when is something, okay, I can't add another habit. But while I'm doing this, I just have to sit here for 20 seconds while I cure this bonding. Well, hey, this is a great time for me to practice that slow breathing. So I like to think of ways that you can stack those habits in there that are going to have a huge, profound effect, very minimal, input there. So I think breathing is really key. And I've been trying to focus on that, because I found that snoring and sleep apnea, I used to think it was more of an anatomical issue. And now I know so much of it is the way that we breathe, right? Our stress response, the way our diaphragm, most of us, our diaphragm's out of whack. So when I stacked laser therapy, which was kind of stimulating the collagen, right, with sanguinaria, homeopathic, with tongue and breathing exercises, bam, get rid of the snoring and sleep apnea. So, and I think that those exercises are, if you can't, because the laser can be expensive, so you can't afford that, okay, great, just do the exercises. And again, totally free. You can look them up on YouTube, and spend 5 minutes after you brush and floss doing a few tongue exercises.
You are amazing.
I've learned a lot, because I've had to learn a lot for myself.
Thank you. It's just so, I've learned so much. And I feel like Anne, I talk to dentists a lot. I understand the value and the incredible need for biologic dentistry, and also the harm that conventional dentistry can do, often unknowingly. So to hear you explain the mechanisms that the biologic dentists are using so clearly, it is very appreciated. Can you tell our people where to find you? What's the podcast name? What's your email? How can they, get in touch?
Sure. So the website is www.carverfamilydentistry.com. And when it comes up, it says Imagine Health. So we kind of have like two names going on there. And there's a way that you can contact me. I think there's a button that says Ask the Doctor. I've just come out with a new course. It's called 6 Weeks to Reverse Gum Disease. So if you scroll down on that main page, there's a little kind of button there that says you can learn more information. So that was really fun to put together. So again, I think the way to be healthy, like you don't necessarily need the doctor. So if we can empower ourselves with the knowledge, then we can, not have to be in the dental office other than, quick cleaning twice a year or something like that. Right. So I wanted to empower patients to be their own best doctor and get the information that way. My podcast is called The Root of the Matter. You can find that on any of the streaming platforms. I'm in my 3rd season now, so it's very, very exciting. Now I'm starting to do some more solo podcasts because people were saying, we love your interviews, but we want to hear more from you. So now we're doing interviews, and once a month I have a theme that I'm doing some solo stuff. So that's a lot of fun, and that's where you can find me.
Wonderful.
Thank you.
Yeah.
Thank you so much, Dr. Carver, for joining us, and then we'll see you at the next episode. Thanks for joining us today. If you like the episode, please like and subscribe to our channel and review us on your podcast players. Also, if you think this episode is helpful to some of your friends or colleagues, please share it widely. If you are curious about learning about neural therapy or other injection techniques, check out our courses on learnneuraltherapy.com. We'll see you next month for our next installment of the Point of Medicine podcast.